Welcome to the Dizziness Summit. My name is Dr. David Traster. I'm the head of clinical education. I'm a lead clinician and an owner of the Neurologic Wellness Institute in Chicago and Wooddale, Illinois. So what is dizziness? Dizziness is classically referred to as a disorder or a disturbance of spatial orientation, meaning that in order for me to interact with the world, I need to know where my body is in space, where space is relative to my body, so I can interact with the world. With dizziness or vertigo, people have a dysfunction of the spatial orientation, so either they feel like they're moving when they're not moving, or they feel like the world is moving when the world isn't moving. So it's a disruption of what we call spatial orientation, where either I feel like I'm moving when I'm not, or the world feels like it's moving when it's not. Common descriptions of dizziness is rotational dizziness or vertigo, where they feel like they're spinning or the world feels like it's spinning around them. It could have a sense of rocking, where you're rocking side to side and you feel like you're on a boat. You could have a sense of lightheadedness, especially as you stand up too quickly, where you get lightheaded. Some people get dots in their vision. Some people could actually black out and faint. Or some people complain of just weakness in their legs or unsteadiness or balance and gait disorders. Dizziness is a very common and debilitating complaint that we see every day in our clinic. Dizziness ranks among the most common complaints in medicine, affecting up to 35% of the general population. Dizziness also is misunderstood, it's misdiagnosed, and it could be completely debilitating. Up to 30% of adults may report rotary dizziness, what we refer to as vertigo. Vertigo can trigger or exacerbate psychiatric problems. We say a third of people who have dizziness may develop anxiety or psychiatric conditions. A third of people who have psychiatric conditions or anxiety may develop dizziness, and a third of people typically have both. So vertigo and dizziness rank among the top 10 most common reasons for referral to neurologists in both the emergency room and in an office-based setting. Misdiagnosis of vertigo and dizziness is actually too common, and you need really appropriate training for these disorders to really benefit patients who are dizzy, as well as save costs for the system. Identifying the cause of the dizziness, whether it's in the brain, whether it's in the inner ear, whether it's from a stroke or a tumor, is really of the utmost importance right in the beginning and the onset of the dizziness. However, stroke was found to be a very, very rare cause of dizziness that present to the emergency rooms. So we obviously want to rule out things like stroke and tumors, but it's actually a relatively rare cause of dizziness. And so when we look at dizziness or vertigo, what are some of the more common causes of dizziness? Well, the first common cause is a problem in your inner ear. The next common cause is a problem with your neck or your cervical spine. Another common cause is a problem with your jaw or your TMJ. Another common cause is a problem in your brain, especially in the area of your brain called the cerebellum. So how does this generally all work? Different sensors of your body give your brain information of where you are in space. Each one of these systems tells your brain some information about where you are in space. The neck, the inner ear, the jaw, the brain, they should all be saying the same thing about where you are in space and where space is around you. If one of these areas is dysfunctional or sends wrong information, what we call this is a sensory error, meaning that one of the systems that tells our brain where we are in space is sending an improper or a wrong signal or wrong information to the brain. When the brain starts getting different information of where you are in space, again, we call that a sensory error, and that sensory error can produce dizziness. So classically, all of these areas should be telling your brain the same thing, which is where you are in space and where space is around you. However, if one of these areas starts telling your brain something different than another area, we call that a sensory error, and that discrepancy can actually create dizziness. And so many forms of dizziness are actually improper signals from the body or from the inner ear into the brain, telling the brain different pieces of information of where you are in space. And when the brain receives these different pieces of information, it causes dizziness. Here is the inner ear. As you can see, we have an external ear, we have a middle ear, and we have an inner ear. And in the inner ear, you can see 3 bony canals. And in front of these canals, you can see a swirl, which is the hearing apparatus or the cochlea. These 3 canals, you can see an anterior canal, a lateral canal, and a posterior canal. So as you can see here, we have 3 canals, an anterior, a lateral or horizontal, and a posterior canal. And then inside we have a utricle and a saccule. When people have problems or dysfunction in the canals, they typically have what we call rotational dizziness or vertigo. When people have problems in what we call the utricle or saccule, they typically feel like they're rocking. They could feel like the world is tilted or their body's tilted. They could also feel like they're being pushed down by gravity, or they can actually feel like they're floating or having out-of-body experiences. These canals are also in a very specific direction. So the anterior canals tell your brain you're moving forward. The posterior canal tells your brain your head's moving backwards. And the horizontal canals tell your brain your head is moving left or right. And so you can have a problem in a very specific canal and only get dizzy when your head is in one position or when you move your head in a specific position, but not in any other direction or position. So when we look at the vestibular system, at the most basic level, the vestibular system allows us to stand upright and balanced against gravity. The vestibular system allows our eyes to be stable so we can see clear. And the vestibular system tells our brain where we are in space so we feel stable and we don't feel disoriented. Most people are aware of their vision, they're aware of their hearing, they're aware of their taste, they're aware of touch, and they're aware of most of their sensations. But most healthy people are unaware of their vestibular system, because when the vestibular system is appropriate, it should really be in the background and allow you just to function appropriately. However, when the vestibular system is dysfunctional, this is when people really start to appreciate the impact of the vestibular system in everyday life. Because if the vestibular system is dysfunctional, you can have balance problems and difficulty walking around. You can have problems with your eye movements and can create a lot of dizziness and visual vertigo or visual dizziness. And you could also have a problem perceptually of where you are in space, and you could feel like you're spinning, or you could feel like you're rocking, or you could feel like you're sideways or the world is sideways, and it can make it very difficult to perform your daily activities of life. So when we look at this picture, it's important to remember that dizziness doesn't have to come from the inner ear, or it doesn't have to come from the neck, that dizziness can actually come from the brain, and that you need a dizziness specialist who can assess both the inner ear, the neck, and the brain. So when we take a closer look at the vestibular system, what you can really see is your vision and your eye movements relate to the vestibular system. Your inner ear obviously relates to the vestibular system. Information from your body and feet are sent up to the vestibular system, and your vestibular system and your brain take different pieces of information and allow you to function appropriately in the world. For some reason, if information from your eyes is telling your brain something different from your inner ear, this can actually cause dizziness. Or if information from your body is sending signals that are different from your inner ear, this also can cause dizziness. Because what we know is in the brain, we have massive connections of your eye movements, of your inner ear, and of your body, and they are hardwired reflexively linked, meaning that if you have a problem in your inner ear, it can manifest as dysfunction of eye movements or dysfunction of your body. If you have dysfunction of your body, it can manifest as dysfunction of your eye movements causing dizziness. If you have eye movement disorders, it can actually create dizziness and affect your body. And so we can't differentiate your physical body from your inner ear, from your eyes, because they all send signals to your brain to tell you where you are in space, and they're all extremely important for spatial orientation. And if any of these signals is inappropriate or wrong due to an injury, due to an infection, due to a genetic reason, what's going to happen is that different pieces of information going into your brain can lead to dizziness. Or if for some reason you get an infection of your inner ear, that's going to disturb information from your inner ear into your brain. That's going to be different from one side of your inner ear to your other. It's also going to be different from your vision to your neck, and that's going to cause dizziness. So just to show you one more time, you have your vision, which goes to different areas of your brain and eventually leads to your vestibular system. You have your inner ear of your semicircular canals of your otolithic organs in the bottom left part of the picture. And again, that goes to the same vestibular areas that your vision goes to. And then you can see in the lower right, you have your proprioception, which is information coming from your body, from muscles and joints of your body. And that also goes into the same areas of your brain that your vision goes to and your inner ear goes to. And so the vestibular system is a part of your brain that takes different sensory signals and tells your brain where you are in space to allow you to interact with your environment. And so one more time, you can see the eyes go to the same areas of the brain that the ears go to, that the inner ear goes to, that the body goes to. And so all of these senses are combined together to give your brain a sense of reality of where you are in space and what's happening around you. So how do we assess dizziness? Well, we start off by doing a very detailed neurological examination. We also do an assessment of eye movements. We do an assessment of balance. And we really do our best to figure out what is the cause of your dizziness so we can tailor-make a treatment program that's specific for each patient. So each patient gets a very specific treatment program tailored to them and to nobody else, because every patient is unique and deserves a unique treatment. Again, how do we assess dizziness? I think it's important to remember that the brain supplies information to the body, and the best neurological evaluation really comes down to the ability of the doctor to create good observations and understand the connection between the brain and the body. And so when you look at this picture, this is a picture on a building in Chicago. And I'd ask you, what do you see on this picture? And what we see as clinicians who specialize in dizziness, the first thing that we look at is we see an asymmetry in the eyebrow. And there's certain parts of the brain and dysfunctions of the brain that are going to give you specific findings of one eyebrow is higher than the other. So what else do we see? We see a different in her right eye position of where it is in her orbit versus the left eye position. And again, very specific areas of the brain cause this dysfunction. What else do you see? You see a difference in facial musculature, I'm sorry for the spelling error, between the lower right side of the face and the lower left side of the face. And again, very specific areas of the brain cause this facial asymmetry. What else do you see? You see her eyelids. And so what you can see is her eyelid. One eyelid is lower than the other. And again, very specific areas of the brain cause these eyelid asymmetries. And so while most people will look at this picture or look at a person in front of them and they'll just see Mary, someone who's trained on dizziness should be able to say, I see the asymmetry in the eyebrows, I see an asymmetry in the eyelids, I see an asymmetry in the eye position, I see an asymmetry in the lower facial musculature, and a good clinician should have a really good picture of what's going on in this person's brain just by looking at their face. And so in 1 minute, a skilled clinician can have a pretty good idea neurologically of someone in front of them. Now just imagine if you took an hour to assess somebody, how much information can you get about a person's brain? And with that information, can you use it to help someone? So at the Neurologic Wellness Institute, it's my job to train all of our clinicians, and it's my job to make sure that every one of our clinicians is very well trained on not just diagnosis and assessment, but also treatment and taking an examination and understanding how to find the specific cause for each person's dizziness, and then translating that into a very specific treatment program based on that person's unique causes. So in conclusion, dizziness is one of the most common complaints in medicine. Dizziness can be debilitating and create secondary mental health problems. Dizziness can be from a number of causes and may require different treatments depending on the cause, and it is always best to find a trained specialist in dizziness if you or someone you know is experiencing dizziness. So thank you so much for your time, and I hope you have a great day.